Welcome to the Your Health Matters podcast. February is American Heart Health Month. It's all about raising awareness about heart health and urging those around you to prevent heart disease. I'm Sarah Carnes. I'm very happy to be with you today. And my guest, Dr. Bittenbender from Summa Health. Thank you for joining us.
Thanks for having me.
Yeah, I was digging a little into heart health, and the numbers are kind of staggering to me. I guess I didn't realize over 10% of the U.S. population gets diagnosed with heart disease. So when you run those numbers, it beats out cancer. It beats out everything else. And you think cancer, you think scary, right?
Yep, you think scary, but still heart disease is the number one cause of death in people in the United States.
Yeah, so it's a big deal. And that's why, we wanted to bring you on to talk about this because it affects so many people. First of all, when it comes to heart disease, I want to know what are some of the symptoms and who does it impact the most?
So I think commonly when we think about heart disease, we're thinking about coronary artery disease or disease of the arteries that feed the heart muscle and keep the heart muscle happy. And when those develop blockages, they cause heart attacks, and that's when sort of the scary things happen in heart disease. Symptoms that might tell you you're brewing coronary artery disease are chest pain or shortness of breath, particularly when you're trying to be active. So some people will say, well, I feel fine sitting watching TV or laying down to go to bed, but I go up a flight of stairs and I get this pressure in my chest. Mm-hmm. Or 6 months ago I could run up these stairs fine, and now I'm stopping halfway up because I'm short of breath. Those are probably the two most common symptoms in somebody who's developing coronary artery disease.
No, can it happen to anyone? I was talking with someone this morning just by chance, and they had said that their brother at 38 years old died of a heart attack. I mean, I don't know. I didn't ask enough questions to know if he had symptoms or not, but what are some of those things that you can do to prevent even at any age?
So you're right that heart disease becomes more common as we get older in age, so into our 50s, 60s, 70s and above, but it doesn't mean that 30 and 40 and even 20-year-olds are free of that risk. So, there are patients in their 20s and 30s that have heart attacks that need treatment for that. And that's a little bit scary.
Yeah, but I guess I didn't realize. I always think heart disease, and I think you're in your 70s maybe, then 80s. I always think of it being older.
So oftentimes, we all know that certain families have the genetics that lead to heart disease, just like certain families have genetics that lead to more incidences of cancers. Mm-hmm. When you get into your 50s and 60s or 70s, the genetics plays a big part of that. Most often when we see heart disease in patients that are in their earlier years, 20s or 30s or 40s, there are other lifestyle problems that are coming into play, particularly heavy smoking or things at a young age. That's probably the biggest risk factor, particularly for developing early heart disease.
So let me talk about that for a minute then, because lifestyle is such a big part of it. I know you just mentioned that. What are some things within a lifestyle that you can change to help prevent
heart disease?
Yeah.
I think we all, again, know that there's genetic risk out there, but that's not something that we can modify necessarily. So,
but it's really the lifestyle, right, that does it.
Sure.
You can be, just because you're genetically set up for something doesn't mean that's going to happen.
And I tell people that all the time, because people will say, patients will come see me and say, I've got a strong family history for heart disease. And I'll say, well, then it's even more important for you to have good lifestyle habits that decrease your risk. But that, if I'm talking to somebody who doesn't have that genetic risk, it doesn't mean they shouldn't also have those good habits. So no matter what risk you're starting with from your genetics, your lifestyle is going to push that in one direction or another. So if you have lots of bad habits, your risk is going to go up from what your personal baseline is. And if you've got great lifestyle habits, your risk is going to be pushed down from what you start from. But so we all want to get that as low as possible, and just because I started with a different genetic risk profile than somebody else doesn't mean we don't all want to be as low as possible.
Right, and it doesn't mean you shouldn't try. Like I think sometimes people, my family all has it. Right? I'm a lost cause. I might as well just no. That means it's even more important.
Right, and the way to look at it is maybe your genetics are such that you might have a problem in your 60s or 70s or 80s, but if you add on top of that bad lifestyle habits. We'll
Right.
use smoking as the worst example. Well, maybe you're now developing heart artery problems when you're 30 instead of 60, and that's a big deal. So sure, I can't make anybody's risk for anything, can't make anybody's risk for heart disease zero, but I can help you push it as low as possible by having those good lifestyle habits.
Okay, so let's talk about some of those lifestyle habits then. You mentioned smoking. I mean, that seems like, probably obvious one, but there's still a lot of people who smoke and it's hard for them to quit. How important is that?
That is really, if you add up all the other bad habits we can have, smoking still wins as the worst habit. Add all the rest up. So if you are a smoker, quitting smoking is absolutely the best thing you can do to help with your heart health risk. I tell people this all the time. It's not uncommon for a young person who thought they were pretty healthy comes into the hospital with a heart attack, and we say, hey, the bad news is you're a young patient that has had a heart attack before you thought you would. But the good news is, if you're a smoker, we can really modify that risk even after having a heart attack. If you can quit smoking now, you can go another several decades or longer without having another problem if we can modify that biggest risk for you.
What are some other lifestyle factors that fall into play?
So, and I think we all know these things when we sit down and are honest with ourselves.
Right.
But, it's heart-healthy diets and having an active lifestyle with some routine exercise. So the American Heart Association will recommend, 5 to 6 days a week of exercise, 20 to 30 minutes a day when you do it. And, it's not enough to just say, well, I'm an active person. I'm at, the mall, or I'm walking my dog. There is something beneficial about dedicated 20 to 30 minutes of exercise where you're building up a sweat and you're getting your heart going. So it's not enough to just say, well, I'm on my feet all day at work.
Well, see, I think that's the big thing. People think just what you said. Well, I'm active. I walk my dog. I do this. It's like, no, you got to work up a sweat and get your heart rate up and actually work out.
Absolutely. And, the other problem with that, what we all do these days is we have busy lives and busy work schedules. And, we say, well, I'm on my feet all day at work. And then the last thing I want to do is come home and get on the treadmill or do something active because I'm wiped out. But, I've been through those lows before of saying, I'd rather just sit on the couch because it's been a long day. But I try to pep talk myself and say, I have never once sort of motivated to jump up and get on the treadmill or work out and then felt worse afterwards.
That's true.
At my tiredest, getting on the treadmill, you kind of have a new burst of energy afterwards. It just takes sort of dragging yourself off the couch and doing it.
Yeah, finding that motivation. Now, I want to talk about diet. So you mentioned that as a lifestyle. And I think, just as you said, I think we know some of this stuff. I know probably fried chicken every day is not a good idea, but in general, what are some things that you should be doing?
So just as you said, I'm not one that pushes hard to look at every ingredient and everything that you eat because I think that's a hard thing to maintain. But I think fried foods aren't good for us, fast foods aren't good for us. Fresh fruits and vegetables and lean meats and fish are good for us. Most of the stuff you sort of can make homemade are good for you. But I don't nitpick every ingredient that goes into my food. I think, I also tell patients, if it's somebody's birthday and you have a birthday cake, piece of birthday cake, that's okay. But, if 95% of your diet is on the good end of the spectrum and you have, cheat day here or there, that's okay.
Yeah. I think maybe, is that part of the key though? You said 95%.
Yeah. I'm making that number
I know,
up,
I'm just saying, like, it's all about balance, but also probably staying motivated to keep going with maintaining a healthy diet.
And I think a common question I'm asked is, we've all heard hundreds of different diets out there. So, 10 years ago it was Atkins and South Beach, and now there's keto. And
that was my next question.
Yeah, there are all these different diets out there, and which one is right for heart health? And, I'm convinced that they all are of some benefit because they all don't allow you to eat the stuff that's really bad for you. So none of those diets allow you to eat a piece of a fast food cheeseburger or a piece of pizza or, pizza and beer, that kind of thing. But most of those diets are pretty extreme in the instructions they give you, and a lot of them are hard to maintain. So I think you mentioned a word before, lifestyle, which I think is sort of the important way to think about it. Because when I hear diet, I sometimes think crash diet, and I'm going to do this for 30 days. And
I don't like using the word diet.
No, it's all about creating a lifestyle and maintaining, finding something you can maintain. So,
right.
Some of those very extreme diets you can do for 30 days, and people say, "Oh, I feel weird because it's such a drastic change for my life," but I don't think those are maintainable. And then if you crash diet for 30 days and then you go back to your bad habits, you're not really doing good things long term for yourself. So, if you can, eat bad things minimally and, eat other things in moderation, and then find sort of lifestyle changes where you can maintain that for years and decades instead of 30 days, I think that's where you get important benefits.
Yeah. One of the things, because you're talking about diet here, that I think always comes up, and it's eggs.
Yeah.
When you talk about heart health and cholesterol and things like that, are eggs good or eggs bad? What's the verdict on that?
Well, and I actually use that as an example when I talk to patients sometimes about diets, because they'll say, well, what about the keto diet or what? And diets come and go, and one day they're great for you, and then 2 years later they've fallen out of favor in the media, or they've proven that they don't give you that extra benefit. And eggs is the perfect example. I feel like every 5 years we're told they're terrible for us, and then they're great for us. And as of a couple days ago, there was a study that said 1 egg a day is fine for your heart. And, I think that's just an example of, eggs have some cholesterol in them. And if you ate 7 eggs a day, you're probably not doing the right thing for yourself. But if you have an egg here and there,
so you don't have to eat egg whites the rest of your life.
No, and again, that goes into my theory of you don't have to scrutinize every molecule you put in your mouth. But, I kind of urge my patients to be honest with themselves that what's healthy and what's not. And,
right.
Sometimes, again, with busy lives and busy work schedules, it's hard to always eat the best you can. But, I think it's an important thing for your cardiac risk to do as best you can.
Do you see patients that really maybe come into you at first and you tell them about the prevention stuff? Maybe they're at risk. They don't have, full-fledged heart disease. Do you see them turn around by taking up what you tell them about prevention, quitting smoking, whatever it may be?
I do. I will say a lot of patients that seek a cardiologist out for aggressive prevention like that are probably all already doing a lot of the good stuff. I mean, they're the extra motivated people. But I love patients that come in and say, hey, I know I have these bad habits, and what can you help me with? What's the thing I should focus on first? The answer to that is quit smoking. If that's
have you seen you have to quit smoking and seen people do that? And
I have. I will say it's much more common to be successful at that after somebody has a heart attack, unfortunately. And so, I have seen tons of patients come in with their first heart attack. They do okay with it. We treat it, we get them home, they're safe, and they say, I have tons of patients that say, from that moment, I threw my cigarettes away and I never had another one. Or I worked really hard towards it and I succeeded. And I have tons of patients like that. Unfortunately, it's a little hard to motivate when we have that invincible mentality. We've never had something happen to us before. And so that's a little harder, but it can be done and it's worth doing.
Yeah.
And
you just have to have that motivation inside of you to do all those different things. So I want to talk a little bit about, treatments as well. Like, if someone does have heart disease, what are the treatment options? Are there new treatment? Are there advancements?
I think there's advancements all the time. And, I think we can go in two directions with that. One is if you're in the middle of having a heart attack or you've got heart disease to the point where it's causing some heart damage, there are lots of options. Sometimes patients with advanced coronary artery disease or having active heart attacks need stents put in their heart arteries to open up those blockages and get their heart in a safer place. Some patients with really significant and multiple blockages need open heart bypass surgery to fix those blockages. But I think, as we talked about before, there is people are turning, and cardiologists and health professionals are trying to turn pretty strongly towards how do we get to those patients before they have a heart attack.
Well, it makes so much sense.
Sure, and I think they're certainly easier to treat. It's easier to stay healthy rather than get healthy after something bad has happened to you. But, there's a couple problems with that. One is the motivation sometimes isn't there when you've never had an event. And the other is trying to figure out who is at highest risk and who should we be most aggressive with in terms of prevention. We don't have all the answers to that yet. And people are trying to figure out blood tests and cholesterol tests all the time that might give us a hint at who should really be aggressive. But the answer is, especially when it comes to the lifestyle stuff, we should all be aggressive about it.
It's true. It's true. It goes to all of us.
Yep.
Well, thank you so much for your time today. It's a pleasure talking about this. If you like to make an appointment with you, learn more, they can all go to your website at summahealth.org.